Good day, everyone. Welcome to the presentation of our case. And this case was prepared by Reliora Crizame and yours truly, Ria Isabela Ruiz. The topic that was assigned to us is the viral hepatitis. And yung case na nakita namin is about a man or a patient with HIV and HBV co-infection. So to start with, this is the overview of the parts na i-discuss namin today. The pathophysiology, the signs and symptoms, the complications, the clinical practice guidelines, the actual patient case, the identification of the subjective and the objective information, and the assessment based on the information gathered, the plan, and lastly, the lifestyle change or the non-drug therapy. So for the introduction, this illustration represents the target organ, which is the liver, and the virus na present if a patient has a hepatitis B or the chronic hepatitis B. So now, let's proceed to the pathophysiology part.
So let's start discuss the pathophysiology of viral hepatitis. Hepatitis is characterized by the inflammation of the liver. And we all know that liver is a vital organ that processes nutrients, filters the blood, and fights infection. When the liver is inflamed or damaged, its function can be affected. Hepatitis is often caused by a virus. And in the United States, the most common types of viral hepatitis are hepatitis A, which is transmitted fecal oral, hepatitis B, transmitted through parenteral and mucosal exposure to persons infected with HBV infection, and hepatitis C through exposure to infected blood. Now, as you can see in the diagram, we have two phases, prodromal phase and ecteric phase. Prodromal phase is the first stage when someone is infected with hepatitis B virus. Now, when the liver is damaged, it produces toxins known as hepatotoxins. Hepatotoxins accumulates in the bloodstream and enters the central nervous system, and then it activates the chemotrigger zone, which is sensitive to hepatotoxins. Chemotrigger zone stimulates emetic center, and as a result, nerves will go to the gastrointestinal tract and will produce retroperistaltic actions, leading to nausea and vomiting. Occurrence of vomiting and nausea will lead also to dehydration or decrease in blood volume, and also electrolyte abnormalities or electrolyte changes. And if these symptoms worsen, it may lead to weight loss. And also, due to the alteration of GI motility, diarrhea may also occur. Another thing that happens when the liver is damaged, it produces cytokines. So what are these? These are interleukin 1, interleukin 6, and tumor necrotic factor alpha. These cytokines triggers the prostaglandin processes in the brain, which is the PGE2 and PGF2. PGE2 and PGF2 change hypothalamic thermostat that leads to fever or malaise, which means general discomfort. So let's proceed now to the ecteric phase. So what is ecteric phase? It is the stage in which the patient develops yellow color or discoloration of the eye and jaundice-like effect. Now, what happens here is that there is a decrease in the production of bile salts in the biliary systems, and the bile salts starts to accumulate in the blood. And also, there is a decrease in conversion of unconjugated bilirubin to conjugated bilirubin. If this happens, unconjugated and conjugated bilirubin will start to accumulate in the blood. And what will happen? These substances will deposit in the tissue of the eye or in sclera of the eye, which leads to yellowish color or known as yellow sclera or icterus. Another thing that happens is unconjugated bilirubin, and conjugated bilirubin will go to the thick tissues of the body, such as palms of the hands and soles of the feet, and will give discoloration of skin known as jaundice-like effect. Also, conjugated bilirubin As it increases in concentration, it will lead to dark urine appearance. And lastly, decrease in production of bile will also decrease in bilirubin concentration, and it will cause decrease in the production or concentration of urobilinogen and stercobilin. So what is stercobilin? Stercobilin is a substance that gives brown pigment to feces. Now, if stercobilin decreases in concentration, it will lead to clay or colic colored stool. So all of these symptoms are characteristics of hepatitis. So let's start discuss naman yung symptoms of chronic HBV or hepatitis B virus. So we have jaundice or yellow discoloration of the skin, fatigue, nausea and vomiting, mild discomfort in the upper abdomen, low-grade fever, dark urine appearance, fever or malaise. We have yellow sclera or icterus, ascite. This is the condition in which fluid collects in spaces within your abdomen. Usually nakikita siya sa mga individual na may liver disease. Malaki yung tiyan nila kasi nga may fluid accumulation na nangyari. And also, we have redness in the palms, spleen enlargement o yung paglaki ng spleen. And usually, it is also known as splenomegaly. Kapag lumaki masyado yung spleen natin, it may remove RBC, and this will lead to a condition called anemia. Next is coagulopathy, excessive bleeding or clotting, hepatic encephalopathy. Ito yung pag-build up ng toxins in the blood and may affect brain function. And usually, people with hepatic encephalopathy may seem confused. And another thing is spider angioma. This is a small red to purple mark on your skin that is caused by dilated blood vessels near the surface of your skin. Kaya tinawag siya na spider angioma because of the mark on your skin that looks like the body and legs of a spider. And also loss of appetite and itchiness.
So before ko simulan yung signs and symptoms part, let's first look at this illustration. So in here, makikita natin yung katawan ng tao and kung ano yung mga organs na meron ng isang tao. So since ang pinaka-focus natin dito is for viral hepatitis B or viral hepatitis like hepatitis B, the target organ of this virus is the liver. So bale, this hepatitis B virus is a virus na pwedeng mag-cause ng hepatitis B, which is isang vaccine-preventable liver infection. Also, it is a hepadnavirus, which is highly resistant to extreme temperature and humidity that invades the hepatocytes. Once na yung liver natin is na-infect na ng hepatitis B virus, it could lead to hepatitis B. So, once na nagkaroon ng isang tao ng hepatitis B, the possible signs and symptoms are fever, fatigue, or yung parang nakakaramdam ka ng panghihina na hindi lang physically but also mentally or pwede din naman combination of the both. Joint pain or yung pagkakaroon ng pain and inflammation sa any part of the joints natin like yung sa bones, sa cartilage, sa tendons, or sa muscles. Next is stomach pain. Next is nausea or yung parang nahihirapan yung intestine natin na mag-absorb ng nutrients na galing sa kinakain natin because of bile production. Loss of appetite, pale stool, which is because of the bilirubin. Kasi 'di ba, yung bilirubin, sila ay normally na nasisikret sa intestine natin. So, bali ang nangyayari, hindi nila nagagawang makapasok sa intestine natin, kaya nagkakaroon ng pale stool. Next is, or lastly, is the dark tea colored urine or yung dark yung kulay ng ihi natin. Now, for the complications, first is cirrhosis. So, bale, kaya siya under ng complications is because kahit yung simpleng infections lang or infection lang na galing sa hepatitis B could lead to extensive scarring of liver or yung cirrhosis na tinatawag natin. So, bali kapag may cirrhosis na, this will impair the liver's ability to function. So, may nabasa ako na it would take 10 to 20 years bago ma-convert or bago mag-progress yung from viral hepatitis to cirrhosis. So, next is the liver cancer. So, in here, related lang siya sa cirrhosis and also it has been reported na ang pagkakaroon nga ng two types of hepatitis or viral hepatitis, which is si hepatitis B and si hepatitis C, ang merong greatest risk of having liver cancer. However, according to the Hepatitis B Foundation, yung mga individuals that are chronically infected with hepatitis B have a 25 to 40% lifetime risk of pag-develop or developing of liver disease or liver cancer. Next is reactivation of hepatitis B. So dito ang nangyayari parang inactivate na or na-inactivate na si Hepa B pero na-reactivate uli siya. So pwede siyang mag-cause ng increase in hepatitis B virus replication sa patient natin. So yung reactivation is pwedeng because of some triggering factors like yung immunosuppressive therapy ng cancer, autoimmune disease, or organ transplantation. So, bale kapag nagkaroon ng reactivation nga ng HBV natin, so pwede siyang mag-lead to interruption ng immunosuppressive therapy natin, like for example, yung mga chemotherapy, and pagka-delay ng treatment ng isang disease or underlying disease na tinitreat natin. Next is kidney disease. So ngayon, nagtataka kayo kung bakit nagkaroon naman ng kidney. Eh, yung sabi ko lang kanina, ang focus ng hepatitis B is sa liver lang. So, bali kasi, once na naapektuhan, ang inaapektuhan kasi ng hepatitis B virus is yung liver. And syempre, once na naapektuhan na si liver and lumala na yung pagka or yung infection sa liver natin, hindi pwedeng hindi aapektuhan ng virus na yun yung ibang mga parts ng katawan natin or yung ibang organs. So, bale, since sobrang infected na yung liver natin, may possibility na magkaroon din ng infections yung ibang organs natin like yung kidney. So bale, yung virus is or yung hepatitis B virus, dinadamage nila yung kidney either directly or pa pwedeng apoptosis or yung process of cell death. So bale, yung HBV DNA has been identified both in glomerular and in tubular cells, and it may promote apoptosis of renal tubular cells through upregulation of the PAS pathway. So, bale, isa sa mga kidney disease na yon is yung polyarteritis nodosa, which is one of the earlier kidney disease that can be triggered by hepatitis B infection na pwede niyang maapektuhan yung mga middle age and yung older adults. Next naman is yung inflammation of blood vessels. So, bale, di ba, yung hepatitis B, ang ginagawa niya is parang nagkakaroon ng swelling or inflammation sa liver natin dahil nga sa infection. And syempre, yung liver natin is meron din siyang blood vessel. So, ibig sabihin, kapag merong inflammation sa liver natin, meron ding inflammation na nangyayari sa blood vessel natin. And di ba yung blood vessel na present sa liver natin is yung portal vein and yung hepatic artery. So, bali kapag nagkaroon nga ng inflammation sa blood vessel na yon or sa blood vessel ng liver natin, pwedeng maapektuhan yung functions or yung actions ng liver natin.
For our clinical practice guideline, we have guidelines for the use of antiretroviral agents in adults and adolescents with HIV. This guideline was developed by Health and Human Services or HHS panel on antiretroviral guidelines for adults and adolescents, a working group of the Office of AIDS Research Advisory Council or OARAC. We chose this guideline because it provides clinical considerations for antiretroviral use in patients with co-infections such as hepatitis B virus HIV co-infection, hepatitis C virus HIV co-infection, and tuberculosis HIV co-infection.
Next is for the actual patient case. For actual patient case, patient C is a man, 32 years of age, with a history of injection drug use, who participated in a free HIV testing day. So his screening test was found to be positive. A confirmatory test conducted at the health department was also positive. He has therefore been referred to the infectious disease clinic of a large university medical center for follow-up. The patient indicates that he injected drugs off and on, beginning at 19 years of age. He reports that he also snorted cocaine occasionally during the years he used injected drugs. Also, the patient smokes 1/2 to 1 pack of cigarettes per day and consumes 2 or 3 drinks per day. The patient's current medication includes acetaminophen or ibuprofen as needed for leg pain and paroxetine for anxiety and depression. The physical examination reveals no acute distress, vital signs are within normal limits, and sclerae are non-icteric. Oral cavity is free from thrush and leukoplakia. Cervical lymph nodes are palpable but movable and non-tender. Heart sounds are normal. Lungs are clear. abdomen is soft, both liver and spleen are palpable, neurologic exam is normal, the patient has a full function in upper extremities and left leg. However, the right leg has a slight decrease in strength and a moderate decrease in range of motion. Next is for the subjective information. So yung ibang parts dito is presented doon sa nakita naming case presentation or sa case ni patient. However, hindi siya or hindi ko siya in-include doon sa actual patient case kasi parang sinummarize ko lang yung actual patient case niya. So in here, sa subjective information, it starts with the patient indicates that he injected drugs off and on beginning at 19 years of age. Next is his first two experience with rehabilitation. Failed, but he has been clean for 2 years since his best friend died on an overdose. Next is he reports that he also snorted cocaine occasionally during the years he used injected drugs. Next is a hospitalization for a motorcycle accident at age 24 with surgery on his right leg, both on that admission and again about a year later. He receives a 2 units of blood during the first admission. Next is he has had pneumonia both in adolescence and again last year. Next is the patient smokes 1/2 to 1 pack of cigarettes per day and consumes 2 or 3 drinks per day. And lastly is the right leg has a slight decrease in strength and a moderate decrease in the range of motion. Next is for the objective information. It is divided into three: the patient information, the lab test, and the medication. For patient information, patient C is a man, 32 years of age. For lab test, his CD4 count is 246. Hematocrit is 44%. Hemoglobin is 15 grams per deciliter. The white blood cells is 3,800. The liver profile reveals an alkaline phosphatase of 143 units per milliliter. AST is 358 units per liter. ALT is 383 units per liter. The total bilirubin is 1.2 milligrams per deciliter, and the albumin is 2.8 grams per deciliter. The hepatitis profile is positive for HBsAg, HBeAg, and total anti-HBC. The anti-HAV and anti-HCV and anti-HBc IgM are negative. However, the PPD is negative. For the medications, the patient's current medication includes the acetaminophen or ibuprofen as needed for leg pain and paroxetine for anxiety and depression.
So let's proceed to the assessment. Included in the problem list was the result of the hepatitis profile of the patient indicating that he is positive for HB-Sag, HBeAg, and anti-HBC.
Next is for the assessment based on the information gathered. So let's start first with objective. And dito sa objective part, magpo-focus tayo doon sa lab test or laboratory test ni patient. So first is his CD4 count is 246 per cubic millimeter. So dito mababa siya kasi yung normal CD4 count dapat is 500 to 1,200 cells per cubic millimeter. And since less than that range yung sa kanya, ibig sabihin mababa yung CD4 count niya. And also, since nabanggit ko kanina na yung case namin is HIV and HBV co-infections, and since mababa yung CD4 count niya, tapos may HIV siya, yung pagbaba ng CD4 count niya ay ibig sabihin nun is yung pinapababa ng HIV yung immune system ni patient. Next is hematocrit is 44%. So dito, normal lang yung sa kanya kasi yung normal range dapat is greater than 40%. Eh, di ba yung 44 is greater than 40%. Next is hemoglobin, which is 15 grams per deciliter. Normal lang din siya kasi pasok siya sa range ng normal, which is dapat 13.8 to 17.2 grams per deciliter. Next is for the white blood cells. For the white blood cells, it is 3,800. So dito mababa lang yung white blood cells niya kasi dapat para masabing normal, dapat ay within 4,500 to 11,000 white blood cells. And also, sa mga patients na may hepatitis B, mababa talaga yung nagiging result ng white blood cells nila kapag nagpapa-test sila. Next is the liver profile reveals an alkaline phosphatase of 143 units per ml or milliliter. So sa result niya, mataas siya kasi yung normal range dapat is 44 to 147 international units per liter. So ngayon, yung sa kanya kasi is 143 units per ml na kung saan kapag kinonvert natin siya sa units per liter, magiging 143,000 units per liter siya. So ibig sabihin, above normal siya or mataas yung alkaline phosphatase niya. So, bale, since mataas yung alkaline phosphatase niya, this could be a sign of liver problems, cirrhosis, hepatitis, and mononucleosis, which is pwedeng mag-cause ng swelling sa liver nga natin. Next is si AST, which is 358 units per liter. So, dito mataas siya kasi dapat yung normal is 8 to 33 units per liter lang. And since mataas yung level na to, this could be a sign of hepatitis, cirrhosis, and mononucleosis kagaya ng effect na nangyayari kapag mataas yung alkaline phosphatase. Next is the ALT is 383 units per liter. So dito mataas siya kasi dapat nga, para masabing normal, 7 to 55 units per liter lang siya dapat. So yung AST and yung ALT na sinasabi ko kanina, yung ALT kasi ang ibig sabihin nun is alanine aminotransferase and yung AST naman is aspartate aminotransferase. So sila ay yung liver enzyme na makikita natin sa liver cells. So ang kanilang actions or yung role nila is tinutulungan nila yung liver natin na mag-breakdown ng proteins para mas mabilis makapag-absorb yung katawan natin. So bali kapag may problema si liver, like for example, na-damage siya or nagkaroon ng inflammation, ang gagawin niya is i-release niya yung ALT and yung AST sa bloodstream. Kaya mangyayari is magi-increase yung levels ng dalawa. And syempre, kapag mataas yung level ng dalawa, it indicates a liver problem. Ang pagkakaiba lang ng dalawa is yung AST kasi enzyme siya na makikita din sa ibang parts ng katawan natin. Like for example, sa heart, sa kidney, sa muscles, and sa brain. Tapos, dagdag ko lang na because nga of viral hepatitis, nagkakaroon ng disproportionate elevations nga ng AST and ALT levels, kagaya nung sabi ko kanina. Next is the total bilirubin is 1.2 milligrams per deciliter. So dito mataas yung bilirubin niya kasi nga syempre yung normal dapat is less than 0.3 milligrams per deciliter. Eh di ba yung 1.2 is sobrang taas niya as compared doon sa normal range na dapat is less than 0.3 milligrams per deciliter. So, bale, since may hepatitis B si patient, nagkakaroon ng pagkataas sa levels na bilirubin, na kung saan, di ba yung bilirubin, isa siyang chemical sa blood natin, na kung saan siya yung nagiging dahilan kung bakit yung katawan natin or yung skin natin is nagta-turn into yellow. And also, dagdag ko din pala na hindi ko siya nalagay kanina, na isa din sa mga signs and symptoms na makikita natin sa mga merong hepatitis B na patient is yun nga, pagdidilaw ng mata or ng balat ni patient because nga of increased bilirubin. And lastly is the albumin, which is 2.8 grams per deciliter. So in here, mababa siya kasi dapat for normal range, dapat is 3.4 to 5.4 grams per deciliter. So since may hepatitis B nga si patient, and since yung albumin nga is made by the liver, and di ba kapag may hepatitis B, mayroong problema sa liver. And once the liver is damaged, the liver can no longer produce the albumin. Kaya anong nangyayari? Bumababa yung levels niya. Next is for the medications. The patient's current medication includes the acetaminophen or ibuprofen as needed for leg pain and paroxetine for anxiety and depression. So, dun muna tayo sa acetaminophen. So, yung ano kasi dito ni acetaminophen is pwede siyang makapag-cause ng drug-induced hepatitis. So, ano ba yung drug-induced hepatitis? Siya ay yung merong mga drugs na pwedeng makapag-cause ng hepatitis na kung saan during high dose, yun nga, pwede silang makapag-cause ng hepatitis. Pero once na in-stop mo yung drug na yon or yung suspect drugs natin, pwedeng mawala yung hepatitis. And isa nga doon sa drug-induced hepatitis na yon is yung acetaminophen. So parang ina-advise talaga na wag i-take yung acetaminophen in higher dose or yung tipong aabot na sa pagkakaroon ng toxicity ng acetaminophen. Next naman is for paroxetine. So si paroxetine, as indicated in the slide, it is an antidepressant agent na ginagamit for depression and anxiety disorder. So bale, although it has a low side effect and a high safety profile, some cases of severe toxic hepatitis associated with paroxetine have been reported. So, ibig sabihin kasi, nakakapag-ano siya ng hepatotoxicity. So, hepatotoxicity kasi, isa siyang, sabihin natin, toxic hepatitis or yung toxic liver disease na po pwedeng makapag-damage sa liver natin. Next is assessment based on the information gathered. Sa subjective information naman tayo. So, dito, let's focus on the part ng kung saan sinabi na or ni-report niya that he also snorted cocaine occasionally during the years he used injected drugs. So dito kasi, yung cocaine kasi, hindi ko lang siya na lagyan ng picture dito. So yung cocaine kasi, yung pagtaas ng paggamit ng cocaine or is pa pwedeng mag-lead to risk na kung saan pa pwedeng magkaroon sila ng infectious disease nga, kagaya ng disease naman sa patient, which is si HIV and si hepatitis B. Next naman, let's focus on a hospitalization for a motorcycle accident at age 24 with surgery on his right leg. Both on that admission and again about a year later, he received 2 units of blood during the first admission. So isa kasi sa mga nakakapag-contribute ng pagkakaroon ng hepatitis B is yung blood transfusion. Eh sa case kasi ni patient, yun nga, nagkaroon siya ng history of blood transfusion. So paano na ko-connect or ano yung kinalaman ng blood transfusion sa hepatitis B. Kasi may possibility kasi yung nung nag-undergo ng surgery, may possibility na hindi na-sterilize ng maayos yung mga equipment or medical equipment na ginamit sa surgery ni patient. Or pwede din na isang maging dahilan is merong nakitang traces of virus doon sa blood na isinalin kay patient. Kaya nakaka-develop siya nung hepatitis B virus. Next naman is doon sa he has had pneumonia both in adolescence and again last year. So, balik kasi yung pneumonia, ito sa slide natin, may nakalagay na Mycoplasma pneumoniae is a major cause of respiratory infections and a possible etiology of acute hepatitis. Acute hepatitis due to Mycoplasma pneumoniae infection is often combined with presentation of pneumonia even without lung involvement. So, balik kasi, di ba, parang ang pagkakaintindi natin dito, nagkaroon si patient ng pneumonia nung adolescence pa siya and last year lang. And nung time na yan is 32 years old. So, bale, ang nangyari parang na-inactivate na parang nawala na yung pneumonia pero bumalik uli siya. So, bale kasi ang nangyari doon siguro is, di ba, nalaman niya na meron siyang pneumonia. Tinreat niya to, tapos once na parang nafe-feel niya na okay na siya, hindi na siya nakakaramdam ng signs and symptoms, itinigil niya yung treatment niya. And based dito sa slide natin, kapag itinigil itong treat dito or yung treatment plan natin doon sa pneumonia, pwedeng yung bacterial infection and yung pneumonia nga is bumalik. And also, yung pneumonia, pwede siyang maging resistant sa antibiotic. Kaya ang mangyayari, yung treatment is parang magiging difficult na or hindi na magiging effective yung kanyang treatment. Next naman is yung pneumonia din kasi is most common type siya of infection in HBV-ACLF patient. So ano ba yung HBV-ACLF patients? Or yung HBV-ACLF? Yung HBV-ACLF kasi is hepatitis B virus acute on chronic liver failure. Na kung saan yung acute on chronic liver failure is sila yung mga nare-recognize and masasabing syndrome na makikita sa mga patient na mayroong liver cirrhosis, and it carries a high short-term mortality in excess of 15% at 28 days. Next naman is for smoking. The patient smokes 1/2 to 1 pack of cigarettes per day and consumes 2 or 3 drinks per day. So dito, sabihin natin, yung because of smoking, nagkaroon ng hepatotoxicity. And yung kagaya ng sabi ko kanina, yung hepatotoxicity is pwede siyang maging toxic liver disease or toxic hepatitis. Tapos, sabihin din natin dito na because of smoking, um, cigarette smoking increase the risk of developing HCC among chronic liver disease patients independently of liver status. Association of smoking with hepatocellular carcinoma, irrespective of HBV status, has been reported. So ano yung HCC? Yung HCC kasi siya ay yung hepatocellular carcinoma, which is a common type of primary liver cancer. So bali nag-occur siya sa mga taong merong chronic liver disease such as cirrhosis na dahil sa hepatitis B or hepatitis C infection. Next naman is doon sa nagiinom siya ng 2 or 3 drinks per day. So dito kasi doon sa pag-iinom niya, though ang alam natin is pag umiinom tayo, ang naaapektuhan nga is yung liver, pero pwede din kasi siyang makaapekto doon sa pagkakaroon nga ng infections na pwedeng mag-result into liver disease. Yun nga, kagaya dito, sa the hepatitis B virus and alcohol abuse, sila ay parang nagsasanib puwersa sila para ma-develop yung end-stage liver disease. Alcohol abuse not only cause rapid progression of liver disease in hepatitis B virus infected patient, but also parang ang ginagawa nila is ginagawa nilang chronic yung hepatitis B virus na meron si patient.
So let's proceed to the assessment. Included in the problem list was the result of the hepatitis profile of the patient, indicating that he is positive for HB-Sag, HB-EAG, and anti-HBC. For the drug therapy problem, there are two specific drug therapy problems that we have identified. First is inappropriate compliance. According to the case, the patient is smoking 1/2 to 1 pack of cigarette per day and consumes 2 or 3 drinks per day. This unhealthy behavior would affect or may influence the absorption, distribution, metabolism, or elimination of the drugs and may potentially cause an altered pharmacologic response. Second is adverse drug reaction, which is the result of the current medications of the patient and medication regimen. So we have identified drug interaction between ibuprofen and paroxetine. The current medications of the patient may cause drug-drug interaction. Ibuprofen plus paroxetine can interact with each other, causing pharmacodynamic synergism. Either ibuprofen or paroxetine may increase the other medication and may lead to toxicity of the other. This may increase the risk of upper gastrointestinal bleeding and inhibition of serotonin uptake by platelets. Another one is drug interaction between ibuprofen and emtricitabine. Either of these two drugs increases the other by decreasing renal clearance. Toxicity may result from co-administration of emtricitabine with other drugs that are also primarily excreted by glomerular filtration and or active tubular secretion, including high dose or multiple dose of non-steroidal anti-inflammatory drugs. So let's proceed to the plan. We can suggest to take ibuprofen with interval of 2 to 3 hours after taking other medications. However, another approach to consider is finding alternatives for the object of precipitant drug. Acetaminophen can be used as needed for leg pain to prevent possible drug reaction when co-administered with the other drug, specifically paroxetine and emtricitabine. However, acetaminophen should be at low dose only because it may induce hepatitis at higher doses. So moving on, since patient was informed that he was co-infected with HIV and HBV, we can develop a medication regimen including tenofovir with lamivudine or tenofovir with emtricitabine to treat both HIV and HBV. Based on the clinical guideline under the considerations for antiretroviral use in patients with co-infections, because emtricitabine, lamivudine, tenofovir disoproxil fumarate, and tenofovir alafenamide have activity against both HIV and HBV, an antiretroviral regimen for patients with both HIV and HBV should include tenofovir alafenamide or tenofovir disoproxil fumarate plus emtricitabine or lamivudine as the nucleoside reverse transcriptase inhibitor or NRTI backbone of a fully suppressive antiretroviral regimen. In continuation, Biktarvy with an active ingredients of bictegravir, tenofovir alafenamide, and emtricitabine 1 tablet per aurum once daily can be given. Based on the clinical guideline, Biktarvy is a complete HIV treatment regimen. And with consideration of the condition of the patient, tenofovir alafenamide was selected because it is the prodrug of tenofovir and as compared to tenofovir disoproxil fumarate, tenofovir alafenamide has or have potentially less renal and bone toxicities. Also, part of the plan is close monitoring of kidney function of the patient, and hepatocellular carcinoma surveillance every 6 months is required for people with chronic HBV infection, since they are at increased risk of HCC. Also, patients' lab results reveals that aspartate aminotransferase or AST is 358 units per liter and alanine as alanine aminotransferase or ALT is 383 units per liter, which indicates that there's a problem with his liver. Lastly, according to the guideline, we can recommend tests for HBV DNA to determine the level of HBV replication. And this test should be repeated every 3 to 6 months to ensure effective HBV suppression. And we can also recommend tests for immunity to hepatitis A virus or HAV infection, anti-HAV antibody total, and if non-immune, receive the HAV vaccination. Also, we can recommend healthy lifestyle to patients according to the guideline and the recommendation for patients with HBV and HIV co-infection. Patients with chronic HBV should be advised to abstain from alcohol. Another thing is that patients should quit smoking, safe sex practices, a healthy diet, and at least 30 minutes exercise a day.
So this would be the end of our presentation. Sana mayroon kayo natutunan and thank you very much.